Today, Kimberly Chow and Delia Cortez will define cumulative grief, along with the benefits and risks associated with managing it in our professional lives. This Polaris video was made possible by the American Nurses Foundation.
In healthcare, we're all vulnerable, or we all experience different types of loss. So that puts us at risk for experiencing cumulative loss. It's a little bit tricky to identify sometimes because it does happen over time, and it's not related to one specific event or situation. And by the time that we identify it as healthcare professionals, we may be in the midst of it, or it may be, a bit more advanced.
Essentially, in the healthcare world, anyone who touches a patient in some way, shape, or form is at risk for cumulative grief. And that can include frontline healthcare workers such as nurses, doctors, social workers, chaplains, nursing assistants, or sometimes they're called patient care technicians, and even employees who greet patients and caregivers at the door each day, or the environmental specialists that we work with on a day-to-day basis. All of these people are part of the patient's journey.
We want to encourage you to take a moment and think about the definition of cumulative grief and think about how this applies to your practice. We want to normalize that experience for you, that given the nature of our work in a healthcare setting in all capacities, we are all exposed to causes that contribute to cumulative grief.
It's very important to distinguish between what grief is, the normal process of grieving when someone experiences loss, and then the process of loss after loss, and that accumulating over time without moments to pause, gain closure, and to really complete that process before moving on to the next one. And if there's not enough time to process that loss, that individual accumulates the physical, emotional, spiritual symptoms associated with grief that goes unmanaged or unresolved.
Some signs and symptoms of cumulative grief may include physical illness, feeling nauseous, headaches, fatigue, changes in sleep, wanting to, harm ourselves and our life. There may also be apathy, so kind of a disregard for our practice or life. Changes in mood and behavior, an increase in depression, feelings of anxiety, perhaps even coming into work and feeling at a higher level. So this is just, kind of a short list. There are definitely other things that we may experience, and we really encourage you to kind of take note of that, of any changes in your person.
What I want to highlight is that it's not the same for every person. It's going to be different depending on the individual. If you feel like you're not like yourself, or a family member or a close friend says, "Is everything okay? You seem a little bit off." Those are some very, quick ways to tell that maybe maybe something else is going on.
Some of the risks of cumulative grief may include emotional detachment from our work, from our personal lives as well, or maybe the opposite. There's an overinvestment in patients' lives where perhaps we feel we're the ones to do it all and we're going to do it all.
Over time, the loss of physical health and psychological health, poor self-esteem, increased absenteeism. So you have more people that are calling out for work. There's, of course, that risk for substance abuse and performance issues. So if cumulative grief goes unchecked or unaddressed, it affects the individuals, the people around them, as well as the larger healthcare system. One of the known risks of cumulative grief is that many of these providers and healthcare workers will leave the profession altogether, which then puts on more burden on the existing staff.
What can you do for yourself? Self-reflection of your experiences with loss in your professional role. Think of the patient, the family member, the coworker. Sit with that reflection and really spend some time thinking about the interactions you had with the person and what this loss has meant for you.
So if you're watching this video and you're all of a sudden coming to some sort of realization, I think right now, the best thing you can do is just pause, figure out what works for you, whether that's a deep breathing exercise, a mindful meditation, putting on a meditation app. I mean, there's so many things available on our phones right now that we can do. What's important to realize is that you are not attached to the outcome. This is the patient's journey, not yours.
So perhaps engaging in developing, bereavement rituals. It may be a prayer For peace and strength, it may be something symbolic like a memorial stone or a note, something that allows you to engage in a ritual and move you through this grief by acknowledging it and validating it for yourself.
I love that, Delia. And we also discussed how much we love almost like shedding your role at the end of your day also. So one thing that really stood out to us was taking off the stethoscope or your ID badge at the end of the day and saying, I'm not that person right now. I'm going home to my family, to my life. And I did everything that I could do today. And we both really like that, right? Like the shedding of the role at the end of the day, so that you really have that fine separation between work and your personal life.
We hope you enjoyed this discussion. To learn more, download our resource guide about avoiding or managing cumulative grief as a medical professional.